వెల్కమ్ టు హెల్త్ ఫైల్. బరువు కొంచెం అటు ఇటుగా ఉండడం సాధారణమే, కానీ అధిక బరువు అయితే మాత్రం అది తెచ్చే అనర్థాలు ఎన్నో. గురక దగ్గర నుంచి సంతానలేమి వరకు అనేక రకాల సమస్యలకు అధిక బరువు దారితీస్తుంది. మరి దీనికి సర్జరీ ఎప్పుడు అవసరం? బేరియాట్రిక్ సర్జరీని మెటబాలిక్ సర్జరీ అని ఎప్పుడు అంటారు? బేరియాట్రిక్ సర్జరీ వల్ల ఎలాంటి ఉపయోగాలు ఉంటాయి? ఈ వివరాలన్నీ అందించడానికి ఏఏజీ హాస్పిటల్స్ బేరియాట్రిక్ అండ్ మెటబాలిక్ సర్జరీ అసోసియేట్ డైరెక్టర్ డాక్టర్ అభిషేక్ కటక్వార్ మనతో ఉన్నారు. ఆయన అడిగి మరిన్ని విషయాలు తెలుసుకుందాం. నమస్తే సార్, వెల్కమ్ టు ది షో.
నమస్కారం.
బరువు, డయాబెటీస్ ఎంతవరకు కొరిలేటెడ్? రెండు ఒకేసారి ఫైండ్ అవుట్ చేసే రిస్క్ కూడా ఉందంటారా?
Diabetes and obesity, they are both related. We call them sisters. And to understand that, we have to understand how obesity can cause diabetes. So जब मोटापा आता है तो मोटापे के साथ धीरे धीरे कुछ चेंजेस आते हैं शरीर में which are inevitable. You cannot avoid them. The most important change is insulin resistance. And when somebody becomes insulin resistant, the problem becomes more and more severe. Then somebody develops non-alcoholic fatty liver disease because of insulin resistance. And insulin resistance, non-alcoholic fatty liver diseases disrupts your metabolism. And when your metabolism is disrupted, the whole metabolic syndrome starts happening very slowly over a period of time.
As I said, obesity and diabetes are directly related. ఇంకా ఏ అదర్ డిసీజెస్కి గురయ్యే రిస్క్ ఉందంటారు?
So because of obesity, as I said, it's a mother of all diseases. I can tell you 10 problems which can happen. The first one is, as he directly said, diabetes, followed by non-alcoholic fatty liver disease, then hypertension, heart-related problems. Then obviously when somebody gains weight, there are a lot of things which happen indirectly. They can affect your health. Like in female, it can cause polycystic ovary disease, which can cause infertility. Also, lot of people, when they gain weight, they lose their confidence. So many of them have depression which is undiagnosed. They lose their confidence. They have a lot of body image issues. They are not confident enough to tackle their personal social life. So it's not just about the health, but it's also about the mental health which gets affected with obesity.
అంటే ఎలా మేనేజ్ చేయొచ్చు అధిక బరువుని కంట్రోల్లో పెట్టాలంటే? వాట్ ఆప్షన్స్ ఆర్ దేర్? దానిలో లాంగ్ టర్మ్ రిజల్ట్ వచ్చే ఆప్షన్ ఏదంటారు?
See, when we talk about weight loss, the first and the foremost important thing is the lifestyle intervention. When I say lifestyle intervention, it means that somebody has to be very active, do regular exercises and have control on your calories, which means that you should take a balanced diet. But the problem is we are living in a world where everything is easily available. We have been made addicts to sugar and all these fast food, high calorie dense food, and then it's sometimes become impossible to avoid that. The problem is, once this weight gain starts, the person should become conscious and should start working on the weight loss. Most of the people who reaches out for some help, they have already crossed that stage wherein this lifestyle intervention can help them. So what happens is, they have tried many times all these keto diets and other kinds of diet. Unfortunately, they lose some weight, but the problem is they gain more than what they have lost, which is a big problem for them. So eventually they start losing confidence on their diet programs. And when we say long term, we need to understand that we are not talking about 5 kgs or 10 kgs weight loss for a person who is around 130, 140 kg. We are talking about at least 40 to 50 kg weight loss. And when I say 30 to 40 kg weight loss, it's a big margin. I don't say that it is unachievable. A lot of people can do it. But 90% of people cannot lose 30-40 kg weight loss just with lifestyle intervention. And there comes the role of some kind of intervention, which could be a medical intervention or it could be a surgical intervention like bariatric and metabolic surgery.
బేరియాట్రిక్ సర్జరీ అంటే 30-40 కేజెస్ ఓవర్ వెయిట్ ఉన్నప్పుడు యు ఆర్ సజెస్టింగ్ బేరియాట్రిక్ సర్జరీ. బేరియాట్రిక్ సర్జరీ వల్ల ఎలాంటి ఉపయోగాలు ఉంటాయి? హౌ డస్ ఇట్ హెల్ప్?
Bariatric surgery is a very advanced procedure. First of all, we need to understand that this is not a cosmetic surgery. In bariatric surgery, we do not take out any fat from your body, This surgery is done by laparoscopy, which is a keyhole surgery. We don't cut, we don't make big scars. It is not like a lot of people think that, a lot of women who had their cesarean section, they are scared of surgery. So in laparoscopic surgery, we don't give big scars. It's just 3 or 4 small holes which are around 1 or 2 centimeter. And we do the whole surgery with laparoscopy without cutting the abdomen. And when we do this surgery, we do some changes in your stomach and your small intestine, because the stomach and small intestine produces lot of hormones which are important to regulate your metabolism. And once we do that surgery, slowly your metabolism will change. But the most important thing is people who are diabetic or people who have very high blood sugar, immediately within 24 hours their sugar level comes normal. They don't need medication after bariatric and metabolic surgery. The weight loss will happen over 3 to 6 months.
Their joint pains and all such things also will be under control.
Yes.
Osteoarthritis and everything.
Yeah. So when we say about osteoarthritis, obviously we need to understand that all your body joints and spine, knees, everything are supposed to bear a certain amount of weight. But as the weight increases, it produces a lot of friction in your joints. And because of that friction, your bone gets eroded, and the synovial fluid, which is a very important fluid, it's nothing but the grease of your joints, that grease dry up, which causes the joint pains and osteoarthritis. Same stands for obstructive sleep apnea. Most of the people don't know that snoring or ghurga is a problem because it's a disease. What happens with snoring or sleep apnea is when you sleep, your tongue falls back and there will be typical snoring. The snoring will continue for some time, then people will take a pause for some time, they will not have snoring, and then they suddenly get up, they change their position, which is typical of sleep apnea, wherein when people are not snoring, that is a time when they are not breathing. So sleep apnea means sleep is sleep and apnea is absence of breathing. So people who have this problem of sleep apnea, they have, like what we have hypertension because of the heart, they have pulmonary hypertension because of the pressure on the lungs, which causes a lot of other problems. So after bariatric surgery, in fact before surgery a lot of people need CPAP or BiPAP machine, but after the surgery is done, most of them, they don't need it beyond 1 or 2 months, and they have a very good quality of sleep after that. In fact, I have a lot of stories to share about sleep apnea. In fact, one of my patients came back and told me, doctor, I could sleep nicely after 10 years and my wife did not push me in the night, and indirectly you saved my married life. That is what he said.
Those who undergo bariatric surgery, along with their weight, diabetes reversal also permanent?
See, diabetes is a chronic problem. It will not be a good word to use that diabetes can be completely cured, but diabetes can be reversed completely, that is possible. And when I say that diabetes can be reversed, yes, that is why we call it metabolic surgery, because it completely reverses your diabetes. The HbA1c, which is nothing but the average blood sugar of the individual, it goes below normal and their sugar levels are maintained. So not only the weight loss but also the diabetes improves. And why diabetes is reversal is important, because when somebody is diabetic, we say that it takes 10 years for diabetes to damage your eyes and your kidneys. That is why people with diabetes, we ask them to check their eye test, check their retina every year, and check their kidney function test every year. So what happens is, if we reverse the diabetes by surgery, once the blood sugar levels comes under control, the damage can be delayed further, which can be a great help, because if somebody has a damaged kidney because of diabetes, obviously they have to undergo dialysis, then kidney transplant. In fact, when we talk about non-alcoholic fatty liver disease, I'll tell you an example. 10 to 15 years back, most of the transplants which were happening because people who were drinking alcohol or who had hepatitis infection or something. But nowadays, most of the transplants are happening for people who never had alcohol in their life, but they had fatty liver, which eventually progressed to cirrhosis of liver, and they need transplant. Now there are two problems. If somebody is overweight around 140 kg and has a need a transplant, the transplant cannot be done because that small portion of liver which we take from the donor is not sufficient for that body weight. So they have to lose weight before they undergo transplant surgery.
Anesthetic medicine dose also will be more for the obese people, is it true?
Yeah, because when somebody's weight is more, they have to calculate that anesthetic dose according to the weight. But now the most important thing is the technology and the anesthesia advancement is so high that most of my patients, they walk out of the operation theater immediately. So once the surgery is done, our team is so strong that they reverse the patient out of anesthesia on the operating table. And I have a lot of videos where patient is walking from the operating table to the room.
Oh, great. ఇప్పుడు హెల్త్ ఫైల్లో షార్ట్ బ్రేక్. వెల్కమ్ బ్యాక్ టు హెల్త్ ఫైల్. ఎవరికైనా సర్జరీ అంటే ఫియర్ ఉంటుంది. యాజ్ లాంగ్ యాజ్ దే వుడ్ లైక్ టు పోస్ట్ పోన్ ఇట్. అంటే స్ట్రిక్ట్ డైట్ తోటి ఒక స్టర్న్ డెసిషన్ తోటి దే కాంట్ కంట్రోల్ దేర్ వెయిట్.
As I said before, the most important thing when we say about weight loss is the lifestyle intervention. But unfortunately, it doesn't work on everyone. And it takes a lot of courage. I tell you, it takes a lot of courage to walk into a bariatric surgeon's room for consultation because you are scared that you will be advised a surgery. So I want to tell you something, that everyone does not need surgery. It's not that if you are overweight slightly or you are on the higher side, you would need surgery. It is better to consult a doctor, a proper doctor who knows about obesity and who knows about diabetes. So you should consult an expert in obesity and diabetes and then take a decision. I will say that don't be scared of surgery because things are very advanced. We don't need to be in hospital beyond 2-3 days. You can walk within 3 hours after surgery. You can go back home 2-3 days. You can resume your work from 7 days after the surgery, and the recovery is very, very fast. In fact, sometimes my patients tell me that, doctor, have you really done something because I don't have pain?
Those who have some idea, bariatric surgery is useful to overall weight reduction and liposuction, ఒక particular body part లో fat deposits ఉన్నప్పుడు that is useful. Have you ever suggested liposuction after bariatric surgery also?
Yeah, so what happens is, if somebody is very overweight, maybe around 130, 140 and is around 40-45 years old, obviously the skin elasticity will not be as great as a small kid. So definitely they will have some loosening of the skin around their waist or in the arms or in the biceps region. So if somebody wants, we do have aesthetic surgery wherein we do liposuction along with abdominoplasty or tummy tuck so that the abdomen becomes flat. And we take out that redundant portion of the skin.
మెడికల్ ఇన్సూరెన్స్ కానీ రియంబర్స్మెంట్ అవి ఎంతవరకు పాసిబుల్ బేరియాట్రిక్ సర్జరీకి ఉన్నాయంటారా?
So before 2020, insurance was not covering bariatric surgery. They were claiming it to be a cosmetic surgery. But then IRDA said, IRDA is the regulatory body for insurance, they said that bariatric surgery is a life-saving procedure. It is not cosmetic procedure. So they have started covering bariatric surgery in the insurance after 2020. All big corporate insurance companies have to pay for bariatric surgery. Yes, there are definitely some rules they have to follow. There are some locking period. One need to talk to their insurance provider, or you can check with your insurance company whether they cover bariatric surgery or not. But insurance companies cannot deny bariatric surgery procedure. That is a rule.
బేరియాట్రిక్ సర్జరీ ప్రిపరేషన్ ఎలా ఉంటుంది? 1 day before, same day after post surgery?
When we have someone who is supposed to undergo bariatric surgery, we give them clear-cut instruction. We always check that what is the motivation of this individual. So we do a lot of counseling. We tell them that you can speak to our patients who had this surgery. So we call it support group system, which I started practicing when I came back to India 10 years back. So wherein we involve people who had their surgery and we ask people who want to undergo surgery, we connect them, they talk to each other, and that gives lot of confidence to the person who is supposed to undergo bariatric surgery. So everything is protocol based. As I said, we follow strictly the protocols. So everything is protocol, which means that we'll tell you each and every step when it is needed, right from the pre-operative counseling, pre-operative investigation, pre-operative fitness. We admit the patient one day before surgery for preparation, then next day surgery is done. The surgery hardly takes 30 to 40 minutes, and then a person can be shifted to either for observation in ICU for 24 hours. Then next day we start them on clear liquid diet, which means that we start them on water and coconut water. And slowly we progress that water, increase the amount of clear liquid. And once a person is able to tolerate around 1 to 2 liter water or coconut water, we discharge them without any problem.
Just now you said, when one person is overweight, he will be depressed and mood swings will be more. Post surgery, because of the strict diet rules and all those regime, do they face any mood swings? Have you ever experienced such kind of things?
Yeah. So I call it train your brain. So you need to understand that something has changed in your stomach and your intestine, but the brain does not know that. So it takes a lot of time for your brain. And it is like a computer. When you reset your computer, it takes for computer to reboot and start again, maybe 10 seconds, 15 seconds. So we need to give that much time to your body, to your brain, to understand that something has changed and this change is good for you. So I tell my patient, whenever you have this feeling that, oh, I am hungry, I want to eat something, don't stop yourself. You can go and have something. Not the calorie dense, not the sweets or colas or sweet drinks, but anything which is there. It could be a salad or anything. Don't starve yourself. Immediately once you take that, you will feel full. So your brain will again understand, no, I'm not hungry. So this is what is called train your brain after surgery. There's a lot of therapy involved after surgery. We need to come for follow-up. We ask them to see us at 1 month, 3 months, 6 months, 9 months, 1 year, so that we can detect if there is any problem they are going through.
Nowadays, people call gut is our second brain. We have to synchronize brain and our gut brain after post surgery.
Yes. So that is what I told you.
Train your
brain. So you have to understand that brain does not know that somebody had surgery 2 days back. The brain is still thinking that, okay, I used to eat a big bowl of rice, curry and colas and biryani. So it will say, okay, let's eat again. But once you start eating, you will be full immediately. So your brain will get that signal that no, I'm full. So slowly it will happen.
Can you please share a couple of success stories with us?
That's very interesting. I have lot of success stories to say, but there are few which are very important. The one I already mentioned about the person who was snoring. And usually after surgery, you expect that patient will come back to you and say, doctor, I am losing weight, I am feeling better, my life has improved. But this guy came back and said, doctor, you saved my married life.
Yes.
That's very different, but that's very positive. Another story is about a lady who had a very strong family history of polycystic ovary in the whole family. And she was about to get married. And, she came to me with her fiance. And she told me, doctor, this is my going to be partner, and we have a very strong concern that since my whole family has polycystic ovary, infertility in the family, there are no kids in the family, and I also have polycystic ovary, and I'm also overweight, hypothyroid. If I do bariatric surgery, what are the chances that my fertility will improve? So I told her that definitely there are enough publication, there is enough research which says that it increases your fertility, but we cannot give you a guarantee. But then she opted for bariatric surgery because she wanted also to lose weight, look better. We did a surgery upon her, and she was from Dubai. She went back, and suddenly after 3 months, she texted me that, doctor, for the very first time I had my normal menstrual cycle without any pills, and I feel like a complete woman. That was such a satisfactory message. Then I forgot about her. We were in the follow-up. Again, 6 months later, she messaged me, doctor, I'm pregnant without any IVF or any IUI treatment. I feel so great. Then after 9 months, she sent a picture of a newborn kid and she told me that, doctor, you are the first person to whom I am sending this picture even before my parents.
Oh.
Because I think that whatever has happened is just because of the decision which I took at the right time.
Very surgery
inspiring.
completely changed her life, and it has made her complete woman, mother also.
Yes.
Yeah, last piece of advice, sir, to the viewers.
Though I am a bariatric surgeon, but I want to give this message to everyone that don't wait till you become overweight or obese or you need a help from a bariatric surgeon. So be mindful. If you see that you are gaining weight, probably if your ideal body weight is around 50, 60, and if you are 70, 80, whatever, please be mindful. Start doing exercise, start working on your diet. And this is an advice to all of you that most of the people have this feeling that, we have this tradition that we are wearing this smartwatch, and if we do 12,000 steps, the workout is done. Please do not take it for granted. This is the must. 10,000, 12,000 steps is a must. You should be doing something more than that, which means that you should be doing weight training, you should be doing gym, you should be doing regular yoga or body strengthening exercises so that you don't need my help. This is a message I want to give you.
Nice. Well said, doctor. It is very nice talking to you. డాక్టర్ గారు చెప్పినట్టుగా ముందుగానే ఓవర్ వెయిట్ ఉన్నారు అనగానే ముందుగానే జాగ్రత్తలు తీసుకోవడం, డైట్ స్ట్రిక్ట్గా ఫాలో అవడం, అండ్ ఫిజికల్గా లేకపోతే జిమ్ లాంటి లేకపోతే వాళ్ళకి సూట్ అయిన సమ్ ఫిజికల్ యాక్టివిటీ డెవలప్ చేసుకోవడం డెఫినెట్గా చేస్తే బెటర్ అని. ఇంకా బాగా వెయిట్ ఉన్నారు, ఇంకా వాళ్ళ అదర్ హెల్త్ కాంప్లికేషన్స్, డయాబెటీస్ దగ్గర నుంచి ఇన్ఫెర్టిలిటీ వరకు, స్లీప్ ఎప్నియా వరకు, ఇలా రకరకాల కాంప్లికేషన్స్కి గురవుతుంటే మాత్రం తప్పనిసరిగా బేరియాట్రిక్ సర్జరీ గురించి ఆలోచిస్తే అన్ని రకాల సమస్యలకు దూరంగా ఉండవచ్చు. అంతేకాకుండా డయాబెటిక్ రివర్సల్ కూడా సాధ్యమేనంటూ ఏజీ హాస్పిటల్స్ డాక్టర్ అభిషేక్ కటక్వార్ గారు తెలియజేశారు. ఇది వాళ్ళ హెల్త్ ఫైల్. కీప్ వాచింగ్ టీవీ5.